so we can treat it properly and not create this cycle of depression and anxiety and, push and then get worse and.
Thank you. Thank you, Mr. Chairman.
Okay, thank you. Senator Smith?
I think well, I don't think Senator Smith would ever defer to me in anything other than allowing me to speak first, because I have to go do a press conference and then get back here. But I want to echo the appreciation for all of you to show up today and show up every day. I have as everyone I think here, probably in this room, knows somebody who's been going through this. I have an old friend who was amazing person. She was the first female producer of Monday Night Football, which is a strange claim to fame. And for her to be debilitated, it's just hard. I can't get my mind around it. And I know that you're all going through that same psychological evolution with yourselves, but with your child. Anyway, thank you. I've got a couple questions here. Ms. Vasquez, you mentioned in your testimony that the tribulations you went through attempting to obtain a diagnosis of long COVID, the doctors mistaking, some misbelieving, all of those travails. Given the nature of long COVID and also in addition to the symptoms and the biomarkers from patient to patient, I think you have spoken, but all of you really referred to the importance of doing more research, of integrating these stories into research. And University of Colorado is one of the 9 centers that actually got funding from the Department of Health and Human Services to do some of this research. And so, Ms. Vasquez, I was going to ask, what's your sense of what that research should be focusing on? What should be the priorities?
Well, I think patients, again, via lived experience and diving into the existing research, really needs to build on the existing research. Long COVID is not a new thing. ME/CFS is not new. Dysautonomia is not new. Mast cell activation is not new. And those conditions have historically been very underfunded compared to the disability that they have contributed to over generations. And so for me, I think the prioritization is grounding the current long COVID research in the historical infection-associated disease research.
Right. Ms. Beal?
Excuse me. I think the research is extremely important because long COVID is a new illness. And there's so much that needs to happen quickly so that there can be a protocol developed and better treatment for us. I pray all the time for a cure, but I don't know if that will happen for us. But in the very least, there are some medicines that do help some patients, and there's some different therapies that help patients. But if I had a list of what's going to work, try this, then I would go down and try every single one. But I don't know what that list is. Some people try different things, and I don't want to just try different things and make my problems worse. But I don't, we need to know what we can do so that we can feel better.
Right. Ms. Heim?
As I was saying before, share the information we already have. Get it out there. I mean, the stuff that we've tried is not expensive, but it's helped. Like CoQ10 for the brain fog, probiotics, prebiotics. There's stuff that everybody can try. They just don't know to try it. Right. And like she was saying, it gives us hope to at least have an idea or something we can start, somewhere we can start. Because if it works, and we get our lives back, where at least they get better.
Right. Absolutely. There is always an inclination in science and certainly in healthcare to not present things until you understand, have all the facts and know what exactly you can recommend and not. And I think what we're seeing is the necessity of dealing with more uncertainty and being able to navigate with that. Ms. Vasquez, you also talked about the difficulty of going on and off healthcare. You all kind of alluded to the challenges of the red tape and the bureaucracy, but there is a strong demand from the public now to prevent fraud, make sure that we are being vigilant with every tax dollar that is spent. What things do you think that we could simplify? And maybe this is a longer question that you can answer later. But how can we make this paperwork simpler, and yet make sure that we're still protecting, being careful in terms of protecting against fraud?
Yeah, I will say that the threat and fear of fraud is probably much smaller in reality. Nobody wants to be sick. Nobody wants to be disabled in an ableist society. And so I would say things we could do is, I think presumptive eligibility would be a huge start for benefits, and both disability benefits as well as clinical services and community-based services, because there's just such a broad population of folks who are living with this.
Right, right. Well, thank you. I'm out of time, but I appreciate. Sorry, it's a little bit like Jeopardy, where you see someone going to the